Okay, I am going to do a 1-minute brain dump. I have my blank sheet of paper here, and just let me know.
Ready?
Yep.
Okay, start. Five seconds.
All right. Wonderful. I got my little brain dump paper here.
Perfect.
Put that there. Okay. Are you ready, Chloe? All right, here we go. Hello, my name is Amber. I am going to be your student nurse today. I'm going to provide for hand hygiene, and I'm going to close the curtain for privacy. And can you state your name and date of birth?
Joseph Smith, 10/5/1953.
Okay, and do you have any allergies today?
Sulfa and betadine.
All right, sounds good. Thank you. And I am going to use gloves for this procedure. If I needed to wear PPE, I would also use that. So I am going, are you comfortable?
I sure am.
Do you have any questions for me today?
No.
Okay, so I'm going to check the provider's orders, and it looks like, let's see, I have my provider orders here, my MAR, medication administration record, and it looks like we're going to be administering some medications today. Does that sound okay with you?
Yeah.
Okay, and then how do you like to take your medications?
Orally with water.
All right, wonderful. And are you having any pain today?
Nope.
No pain. All right, I will make sure to document that. So I will be back. I'm going to get all that ready, and then I'll come back.
Sounds good.
All right. Here we go. All right, so we have Mr. Joseph Smith. Joseph Smith, date of birth 10/5/1954, 10/5/1954. Digoxin Lanoxin, 0.125 milligrams. Digoxin Lanoxin, 0.125 milligrams. By mouth daily for CHF and atrial fibrillation, for CHF and atrial fibrillation. And this med has not been given yet. We have furosemide Lasix, 40 milligrams by mouth, for CHF, and this med has also not been given yet. Let's see, and that was for Joseph Smith, 10/5/1954. And the time for the digoxin and the furosemide is 12 o'clock, and it is 12 o'clock right now. So we will be, I will document that time. We have Mr. Joseph Smith, warfarin Coumadin, 5 milligrams by mouth, daily for atrial fibrillation, and this med has also not been given yet. I have 12 o'clock for administer time, and it is 12 o'clock right now. And I also have PRN medication. It is for let's see which one we got here.
I think it's on the second page on the provider.
Oh, yeah. See this one. I know I found it somewhere. Right here. Acetaminophen, the oxycodone, acetaminophen, Percocet for Joseph Smith. I know it's on here.
I think it's on the second.
Yep, it's on the second page on this one too. Okay, let's see where we at here. So we have 325 milligrams, 5. Okay, oxycodone. All right, so we have for Mr. Joseph Smith, date of birth 10/5/1954, 10/5/1954. Oxycodone 5 milligram, oxycodone 5 milligram, acetaminophen 325 milligrams, 325 milligrams, Percocet, 1 tablet by mouth every 4 hours, PRN when needed, every 4 hours, PRN when needed. And this med has not been given. This med will not be given today because the patient is not having any pain. If the patient were having pain, I would check to see when the medication was last given. And if it's been 4 hours, then I would give the medication and document for that medication. All right. So then we have our drug cards here. We will not be giving the PRN medication. Let's see. So I have the warfarin Coumadin. For that one, I would. Here, I'm sorry. Keep going here. So for Joseph Smith, it would be warfarin Coumadin 5 milligrams by mouth daily for atrial fibrillation, and that would be at 12 o'clock. And for the labs, we checked. I checked for. Also, I did do. I took vitals and got the apical pulse before the appointment here. And we have 68 for the apical pulse, which is good. It's greater than 60. The blood pressure was 118/78. So that is a good blood pressure. And for the warfarin Coumadin, we were checking for bleeding and bruising, and we didn't notice any bleeding and bruising. The INR is 3.1, and that is not within range. So we will not be giving this medication today because the INR is too high. So I will put that off to the side. And we have the furosemide Lasix for Mr. Joe Smith. This is the 40 milligram by mouth for CHF. And this one, the labs that we are looking at, we are, the blood pressure again was 118/78, so that is good. We have potassium, which is 5.1. That one is out of range. The creatinine levels are 1.2. That one also is high and out of range. And the sodium was 146. That one is high also. So for the furosemide Lasix, we will not be giving that today. Also, the lung sounds were clear, but since the labs are out of range, we will not be giving that one. Lastly, we have the digoxin lanoxin. Looking at my MAR, we have Joseph Smith, 0.125 milligrams by mouth daily for CHF and atrial fibrillation. For that one, we checked the apical pulse. I got 68, and we're giving that for atrial fibrillation and CHF. Blood pressure was 118/78, and the digoxin level is 0.08, which is in range. So this medication is going to be given. So I will be giving the digoxin lanoxin, and do my first check here. So we have, I'm gonna match that with my MAR. The package integrity is good. There's no rips or tears. And the expiration is 04/2041. So that medication is okay to be given. I'm going to check here with my MAR. So we have for Joe Smith, date of birth 10/5/1954, digoxin lanoxin 0.125 milligrams by mouth daily for CHF and atrial fibrillation. Time is at 12 o'clock, and it is 12 o'clock right now, so I will be giving this med now. And we have digoxin lanoxin 0.25 milligrams. So I will be cutting this pill in half when we get back to the patient. All right, so we got everything ready. I did get all of my supplies ready. Got my water, my pill cups, and we have a pill cutter here. Okay, and then for my second check, I will put gloves on. I have for Mr. Joseph Smith, digoxin lanoxin 0.125 milligrams by mouth daily for CHF and atrial fibrillation. Time at 12 o'clock, and it is 12 o'clock right now. I have medication here, and this med has not been given yet. I'm getting it ready right now. Digoxin lanoxin 0.25 milligrams. So this pill will be getting cut in half. Integrity of the package is good, and the date is 04/2041. So I will have that medication ready to be given to Mr. Joe Smith. So we will go back to the room and administer this medication. All right. Knock, knock. Hello.
Hello.
Hi. Oh, I'm not reading.
Get new gloves.
Yeah, I'm gonna grab one. I should have brought the box over with me. Okay, so I have my gloves. And first I'm going to provide hand hygiene and privacy. And then I am going to ask you for your name and date of birth.
Joseph Smith, 10/5/1953.
All right, and allergies?
Sulfa and betadine.
Wonderful. And I have checked the provider's orders. I have some medication here I'm going to give you, and I have held a couple of your medications. So I'm not giving the PRN medication for pain because you stated you weren't having any pain. So I will be sure to document that and let the provider know. And I am going to, it's over here. So for this administration, I am going to be wearing gloves. All right. I will go over my MAR here. So I have Mr. Joe Smith, date of birth 10/5/1954, and I will be administering the digoxin lanoxin 0.125. So I have here the digoxin lanoxin 0.25 milligrams. So I am just going to open that up and in front of the patient so they can see me do that. And then I'm going to cut my pill in half to make 0.125. So put that in my cup. And I will be giving that med. Before I give the med, I want to just go over some actions here with you. So digoxin inhibits sodium potassium ATPase, which makes more calcium available for contractile proteins, resulting in increased cardiac output, increases force of contraction, decreases heart rate, decreases AV conduction speed. And then some side effects would be headache, drowsiness, blurred vision. We have nausea, vomiting, dysrhythmias, and AV blockage. So do you understand all that?
Yep.
Everything sounds good to you?
Mm-hmm. Some side effects I can have are headaches, drowsiness, confusion, hypotension, AV block, blurred vision, nausea, vomiting, abdominal pain.
Wonderful. All right, so we get that. So now I have cut my pill in half to make 0.125, and I am going to administer that to my patient, Mr. Joe Smith. Here, water. All right, thank you very much. And then the other half of the pill I will properly dispose of per agency policy. Let's see, and I am going to document any deviations and let the provider and pharmacy know if I have. I know there was. I know there was something more. If there's any, whatever medications I didn't give, I'm gonna let the provider know. And then, is there anything else I can help you with today? All right, and before I go, I will make sure you have your call light. Use proper hand hygiene. I've cleaned everything, clean all my stuff up, hand hygiene, sanitize everything. Make sure you have your call light. Bed is in low and locked position. Side rails are up. Room is free and clear of anything for fall risks. So we got call light, side rails, bed low, locked position. Room is clear, and then I give you your end table, your side table. See what else did I? And then I am going to come back and check on you in 15 to 30 minutes. And you can also, in the meantime, let me know if if you're having any side effects or anything. That way we can make sure that your medication went down okay, and I will make sure to document everything in Schoology, OneNote, and send it to Schoology.
Awesome.
Okay.